This will probably come as little surprise to many of you, especially those of you working in healthcare. But we're at the beginning of a second pandemic, that of mental health. It's not surprising that my patients have been contacting me a little bit more as the second year of COVID grinds on. But now I'm hearing more and more from family members, friends, and even colleagues just about how much they are starting to struggle as well. A friend of mine, an internal medicine doctor, said to me recently, "I'm not sure what's going on, but I'm starting to feel pretty depressed. That's not like me." I looked at her and I said, "You're not sure what's going on?" We've been in the middle of a global pandemic that has completely shifted and changed our way of life, placing doctors like us right smack in the middle of ridiculous arguments with newly minted internet medical experts. Combine that with the fact that we're not even sure of how all of this is going to end. Yeah, I'm not sure why you're struggling. Although doctors are known for being tough, we are struggling too. But it's not just us. The reality is that no matter how much reserve you have, almost everyone is reaching the end of their rope at this point. Now, what do I mean by reserve? Some people can tolerate quite a bit of stress before they start to feel themselves fraying at the ends. And others, not so much. Everybody has a totally different level of distress tolerance, but no one has infinite reserve. And at this point, what we do have has been taxed to the extreme. After all, it's not just healthcare workers who have been on the front lines of the COVID pandemic. It's our kids and their teachers who have struggled with uncertain educational expectations. It's the general population who desperately wants to have answers and understand what's going on in a rapidly changing situation in which even the experts are struggling to keep up. It's everyone whose job has changed or disappeared. And now there is the resurrection of a Cold War fear that I thought had disappeared in my own adolescence. We are in the middle of a collective depression, and I don't mean financially. Basically, if you're not overwhelmed at this point, at least in some capacity, then you're not human. Look, I have a lot more to say on the subject, but before I forget, if this message resonates with you, please give this video a thumbs up and subscribe to my channel. I think the biggest point I want to make is that everyone needs to give themselves a break. More than one of my colleagues, myself included, has mentioned how hard it has been at times to be therapeutic under the current circumstances. Normally, it would be quite easy. Every one of us is at or nearing the end of our own rope. Collective anxiety and depression is a real phenomenon. I remember feeling it when I was working as a web developer for an international bank in New York City, and our whole department was slated to be significantly downsized. But no one knew who would stay and who would be laid off for about a month. The anxiety was palpable. Walking into the office, you could feel a real sense of dread in the air. Well, we are all now essentially coming out of a collective mass downsizing. So as I said, it's imperative that you give yourself a break. The more we can forgive ourselves for being less than perfect, the easier it is for us to extend an olive branch to those around us. Compassion for others is often challenging, but compassion for ourselves is even harder. There's a lot of research that shows that self-compassion leads to generalized compassion for others, that it doesn't lead to selfishness or narcissism as we sometimes worry, and recognizing our own limitations. And when we have reached our own breaking point, is absolutely crucial if we're going to be there for others. I do hope this was helpful. Now, please be sure and subscribe to my channel if you want to see more mental health made accessible. You can do that by clicking on that link right down there and give the video an old thumbs up. Now, remember, mental health and physical health, they're the same thing. And as we like to say in Pittsburgh, I'll see yins in the next video. Okay, I never blended in very well.